One of the challenges is the whole just instituting a culture of team-based care, because people are used to just working in their little worlds in healthcare, and they haven't worked together as a team. Physicians are probably at the top of the list of having problems with that. So just instilling a team-based culture and having people work together and learn to trust each other is a big part of it. The care team coordinators and your RN does a lot of the things that we used to do, like, for example, contact patient with test results and things of that nature. So you have to learn to trust them, and that takes some time. And the whole culture change is something that we're going to be paying attention to. Change management is something we're aware of. We've seen other systems that had trouble getting to this point and then spreading, so we're really paying attention to that as we go forward. Because change is hard for anybody, and we've got to make sure we manage that well.
So we think we have to have 3 wins out of this if it's going to be successful. There needs to be the win for the provider and the care team, not just the physician, but the entire care team. They fundamentally have to be re-energized if this is going to be successful. The second win was the win for the patient, and if it doesn't serve the patient, then we shouldn't be doing it, because that's the business we're in. The third win was the win for the system. So this had to hold up financially for us and be sustainable and spreadable and scalable.
Having our attention directly addressed to the patient makes a big difference.
I happened to be in a visit with a family member recently, and the physician was doing exactly what a physician would do in today's world. They were at their computer listening to the family member documenting, and the family member I was with literally sat up on the exam table, looked at the physician and said, "Is this a good time for you and I to be talking?"
Very first patient, the first day of the pilot, actually made a comment about how much she enjoyed the new process. And one patient, sometime later, was come out of the room and she actually said something like, "I feel I've got my doctor back." And that's mainly because we're just not having all the distractions that we were faced with before.
I think it's a win for the care team because every single person on that care team is working up to their licensure. They're not just doing a job to do a job, but they're doing a job with a purpose.
It makes it more efficient for nurses, doctors, patients. It's a good way to get to know our patients and really be centered around their care. It helps me personally to get to know them. I'm the one that's calling them a couple days from now, following up, or looking back at their charts and their results and being more centered around who they are and who they are as our patient, really.
The day before the pilot began, I saw a patient who had been in an emergency room in hospitals, different hospitals in town, I think about 6 times in the previous 2 months prior to when I saw her. And she had diabetes and lung disease, and she was smoking and depression and had no insurance on top of it. So I saw her the day before the pilot and I told her, "I don't know what to do with you, but let me get back with you next week." So the following week, as we got the pilot going with the extended care team, here's what happened. Our case manager got involved and found out that she could get insurance, and not only that, but she backdated the insurance, so she was covered for the previous 2 months. Our diabetic services got involved to help control her diabetes. Our health coach got involved to help her with her smoking. And then the RN care coordinator got involved to really oversee all of the different issues. Our pharmacist, to try to figure out her meds, got involved and went to her house and tried to sort through all the medicines and figure that out. So, and then of course behavioral health got involved with her ongoing depression. So literally the entire extended care team has gotten involved, and it's been about 6 months now, and she's had no hospitalization since then. So, and she's feeling better, still having issues, but she's an example of one that we'll catch up with on the extended care team meeting.
It's just more efficient, it's more patient-focused, and overall I think the members of the care team are being utilized in the way that they should be utilized.
A team huddle is a meeting of the core team, so it's the people that actually be seeing the patient that day. And it's basically just running through the schedule and trying to figure out and anticipate what needs the patient might have. It only takes 5 or 10 minutes, but it is surprisingly helpful in making the day flow more smoothly. The team meetings we're doing once a week now, and that's actually with the extended care team. They're always the higher risk patients, a patient with more complicated problems. We've actually found that to really be helpful too in anticipating needs and getting up to date and keeping each other informed as to the status of the patient and what other needs they might have.
I feel incredibly empowered by this design process. I think we've really taken an incredible approach to thinking about healthcare for the future, and we have worked collaboratively with our administrative leaders, and it's been a really exciting opportunity to take that approach and really move forward to helping take care of the patients in a more effective manner, and we all benefit from that.
This is going to require a great deal of change management. It's not a slam dunk. As good as our results have been, the changes that we'll be asking people to make are significant. And we are going to have to work, I think, we're going to have to work very hard at the cultural changes. Physicians giving up a lot of what they've historically done, trusting other people to do things that they normally have done.
It's a lot to learn and take on, but you really catch on quickly. You learn how to expand your own role. It's taking on more responsibility, but it's also shifting that responsibility in your role. You're prioritizing better. You're really trying to figure out how to work with the team and be more involved in that care. And it really, in the end, is awesome for everyone.
When you read about systems that go through this, they always have some quotes from the providers about how much better their world is, and that's definitely been the case. It puts a lot of the fun back into medicine again, which has really been great.